Healthcare in the US is notoriously complicated, complex, and confusing, but it doesn't have to be. Today, we're going to dig into the individual stakeholders in the industry, how they see you, and how you can use that to take charge of your healthcare journey.
Have questions about your healthcare and not sure where to turn? We give you unfiltered insight into how healthcare really works. This is Give It To Me Straight, Doc, presented by Tampa General Hospital and our partners at USF Health Moseley College of Medicine.
Welcome to Give It To Me Straight, Doc. I'm your host, Anjalee Khemlani, and boy, do I have an episode for you today. America's broken healthcare system. Dr. Mark Moseley is our guest. He's the Executive Vice President and President of USF Tampa General Physicians. Dr. Moseley, welcome. I know that this is a hard one because it's very emotional for a lot of people, right? The broken American healthcare system is something that we have been dealing with for years and years. You are part of it, but I'm not blaming you. I just want you to know that. But I want to dig in a little bit and bring out all your knowledge so that our audience can understand how to better navigate this system. The way I like to think of it is it's broken up into sort of three parts. So it's like a triangle of care, if you will. That's the term I like to use. Let's take a look at what that entails. So we've got the doctors, the nurses, telehealth clinicians who see you and diagnose you. You've got insurers and government payers like Medicare and Medicaid who are part of that decision-making process of what kind of care you get. And then there's the pharmacists and the clinical staff at pharmacies who interact with patients, give them advice, help them with their medicines. All of these people are touch points for patients and how they basically navigate their healthcare journeys. Dr. Moseley, you are a doctor. You see all these other players and you see the roles that they play. It must be frustrating at times to have to deal with them as part of the system, but how do you navigate that? And how should patients understand your role in all of this?
Yeah, so first I would just say, the Stoics give us a good reminder that we should worry about the things we can control. And there are things about this that we as individuals don't control. And I think there's a good dichotomy between an individual priorities, needs, wants, and that of institutions. Remember, a few years ago, we crossed the threshold where more physicians are employed and providers are employed than having their own independent practices or having their own small businesses. Those physicians, providers, and their employers have wants, needs, and desires as well. And so the alignment of all of that between the patient, the physician, provider, and the entities, that's a tough alignment to get right. And I think it goes to what you said about how patients might feel that it's confusing, fragmented, and difficult to navigate as a result.
Yeah, I think when we talk about being employed, right, most patients don't know that. They don't understand that that's what's happening. What are the ways that they can learn to ask for and advocate for themselves within a system that is basically looking to make money and needs to continue doing that? Sure.
I think, again, how do we achieve balance in that? It's not wrong for healthcare entities to make money, but I think the ethos of what we as providers want to do with our patients, it begins with that relationship, right? So my encouragement to patients is always think about the relationship first. Think about the relationship that you're going to have with that office or that group of providers and how that makes you feel. We gain consistency, or we gain trust through consistency. I think that's really important because you have to trust the people that are going to take care of you. If you don't trust them, it doesn't matter whether they're employed or in private practice. It's not going to achieve the healthcare outcomes you want. You're not going to be as engaged as a patient. You're not going to be as likely to trust our advice and the things that we ask you to do, which sometimes you might not want to do.
And they could easily go around asking someone else for a different opinion, finding a different answer about their medication from a pharmacist and the like. So it almost seems like, individuals are kind of stuck in between a rock and a hard place, not knowing who to turn to. And this is why we've had for years the frustrations of Dr. Google walks in the room, right, with the patient. And that's changing with AI as well. Do you anticipate that we will have a change in the type of patients, the level of health literacy that they will then have walking in the room when there's so many other players involved in directing their healthcare?
Yeah, that's a great question. I think healthcare literacy is still a challenge. And I think as a physician or provider, it's challenging because you may not know that when you enter the room to talk to the patient, right? And you have to adjust how you're talking and do that in a respectful, encouraging way to patients so that they can understand. You need to create an environment where they feel comfortable asking questions. My 86-year-old dad often after a doctor's appointment will call me and ask me a bunch of questions about his doctor's visit. And I'll ask him, Dad, why didn't you ask your doctor? Well, number one, I didn't want to look stupid and I didn't want to waste their time, right? So we need to encourage patients to have that ability to ask their providers and the physicians and the office staff questions about their care. That builds trust, right? And that's an important part of the doctor-physician or doctor-patient relationship.
Time is an important concept in your world, though. I know that physicians are really strung for time. You are being judged by how many patients you see in a day. You are being judged by how on time you are with each appointment. There's so many factors at play here. And on top of all that, you have the burden of having to input a lot of information into computer systems these days. A lot of reasons why there's, physician shortages across the country. What would you say about the factor of time and how patients should consider that if they feel maybe ignored or like they don't have enough time with a doctor or they can't get an appointment in time?
Sure. And time anxiety is real in this space. I think for the individual patient encounter, I think it helps to really have your questions thought out ahead of time and make sure that that's related to the type of visit. If you're going to an annual examination where there would be plenty of time built in for those questions and health maintenance discussions, that's one thing. But if you're there for an acute issue and you have all of these other things that you want to have addressed, that doctor may not have the time allotted for that type of visit. So I think you want to think about that ahead of time. And again, maybe you bring somebody with you. Sometimes it's easier to have somebody else as a partner or a helper listen while you're thinking and processing the information that you receive.
That's fair enough. What about the other players in this? As a physician, do you see insurers having a significant role in the way that you are allowed to give care?
Yeah, I mean, there's always those external factors, again, things that we may or may not control. Our job as physicians and providers is to take the information we're given and deal with it, right? Deal with it for the individual patient. If something is denied, how do we appeal that denial? If something is denied, are there alternatives that might be reasonable? Again, it's that shared decision-making with patients. It's so incredibly important to help them understand what they have in terms of options.
And that denial, that's part of it that we have to, that we could have an entire episode dedicated to, but we'll leave it right there for right now. And we'll come back to talk about other players that you may not see. Stay tuned. Welcome back to Give It To Me Straight Doc. I'm your host, Anjalee Khemlani, and I've got Dr. Mark Moseley. Okay, so we were talking about all these players in the healthcare system and how you guys all have to kind of work together, even though you don't really work physically together to care for patients. But there's also other players as well. I call them like the sort of the subsectors, right, of the health system. And they are part of some of the same entities. So starting off that list is pharmacy benefits managers. That's a new sort of word for, or string of words for some patients. Clinicians that work at the insurance companies, actuaries also there, and hedge funds and VCs, which are sometimes the employers now of, like you were saying, doctors are employed. And then there's also other factors that people don't think about in terms of healthcare. It's your zip code, grocers, big box retailers. That's part of this idea of social determinants of health, right? The idea that your environment plays a significant role in your healthcare journey, in your health outcomes, in what you even have access to healthcare-wise. How do we think about all these other complicating factors, and how much do patients need to learn about those other factors in order to understand how to better navigate their healthcare journeys?
Yeah, as you mentioned, it's gotten really complex. And I think if we were designing a system from scratch, we wouldn't design it the way that it's ended up.
Who would you take out?
That's a great question. I don't know the answer to that.
Okay.
I think we've evolved in a particular way. And I think all of what you're talking about is helping to manage the incredible fragmentation and complexity that we have in healthcare. Again, what can the individual patient do about that? I don't know. I think being engaged in your healthcare, having a great relationship like we were talking about with your physician or provider, that's really how you combat that, because you have somebody on your side. It's somebody on your team. You're not by yourself. You have a team of people that are helping you, encouraging you, coaching you, mentoring you. And then hopefully those individuals will have the resources that they can bring, maybe sometimes through the invisible hand that you talked about there, versus other resources that they can bring to bear for the patient. The challenge is when it's not aligned with the needs of the patient, right? And patients have different needs. You talked about social determinants of health. Really important consideration that all patients are unique. They have different resource needs. They have different health literacy. So I think for us as a system, we need to do a better job of bringing resources to the patients at the point of care and getting them the care they need when and where they need it.
But there's only so much you can do, right? Going back to the time constraints that we were discussing, there's only so much that you as a physician can do, that you as part of a healthcare system can do. There are only so many resources you can intelligently invest in. So if a healthcare system, and I know I've seen these pilots over the years, some health systems will offer urban farming, and so they'll provide fresh vegetables for the neighborhood, or they'll try to do deliveries, mobile deliveries and kiosks in neighborhoods, preventative services like screenings at local fairs and the like. All of these efforts have been put in place in order to try and catch patients earlier if they have any kind of negative health outcome or outlook. But it doesn't seem to be bending the cost curve at all. It doesn't seem to be really doing the job. And that is the reason why we continue to have players like these invisible hands just sort of operating status quo. There's nothing instigating anyone to change their course of action, because we also as humans don't necessarily want to listen to someone tell us what to do, right? At the end of the day.
Sure.
How do you navigate that? How do we get to the point where we're, thinking about a more cost-effective environment and how to then navigate through all these myriad of players when we don't even have a way to call them up on the phone? I can't call my pharmacy benefits manager.
Yeah. Again, you raise a really important question. I think again, as an individual patient, you have different needs. We're in the sick care business. We're in the healthcare business. But where's the patient's responsibility? Where's the provider's responsibility? Where's the those entities' responsibility for helping people? You mentioned something that's really important. If more people were attuned to their health and wellness, if they, watched what they ate and watched their vices and all of those sort of things, we wouldn't have the epidemic of chronic disease that we have in this country. So now we're forced with a chronically sick population of patients that we have to increasingly provide sick care to. But no one wants to do the easy stuff. The easy stuff's the hard stuff. Right? The hard stuff is eating right and watching your weight and doing those sort of things. And that's not an easy thing to do. Prevention is easy to talk about. It's hard to do. And that's the intersection, right? We have to be able to do both. The question for the individual patient, based on how our insurance and based on the resources the patient needs, is that may be harder or easier depending on the resources of the patient.
Because at the end of the day, we live in sort of an equitable society, right? Everyone's insurance is different. That defines the type of healthcare you can get, where you live, where you belong in the socioeconomic scale defines what food you have access to. All of this are factors that are kind of beyond our control. At the end of the day, some patients can't help but become chronic patients because their environments don't allow for them to get any better. Even if they wanted access to better foods, they can't afford it, right? There's a lot of underlying factors that are defining who we are and how much we get out of the healthcare system. There have been over the years, I know, I like to call this the dirty secret of healthcare, which is cash pay, right? There are ways to access healthcare that may be more affordable that then can help. And with the advent of things like telehealth, I just wonder, do you feel like that complicates your job to have all these external parties like telehealth providers, like those online, platforms that provide prescriptions? Does that complicate your job?
The world's changing. It's more technologically enabled. Our attention spans are less, and people want instant access to that type of care. So I don't know that it necessarily makes it harder. It just makes it different. And you mentioned cash pay, and that makes me think of something like concierge care. There are people now that pay for services, and what they're paying for is access and care navigation. The challenge for us in the healthcare system, in the traditional healthcare system, is how do we democratize that for everyone? How do we give access to that care navigation? A lot of what we're talking about here is the challenge of care navigation through a complex and sometimes Byzantine system that people don't understand, right? We have to help people with that. We have to do a better job. I get told all the time, I'm stuck. Can you help unstick me? Yeah, there's ways we can do that, but we have to find a way to make that more tangible for the individual patient and provide those services.
Well, it seems like there's no way to officially unravel all the players. You can't magically take one out, or you don't want to. And without the roles that everyone is playing, it's hard to understand what a healthcare system would then look like, even with the added digital factors now. This all, I think, contributes to the ballooning cost of care because nothing is being taken out and more is being added. So we're going to get to that in just a second. Don't go anywhere. We're going to talk about the cost of care next. Welcome back to Give It To Me Straight Doc. I'm your host, Anjalee Khemlani, and we've got Dr. Mark Moseley with us. Dr. Moseley, I was just talking about the cost of healthcare. It's the most annoying thing that we have to deal with as patients. We see it in our health insurance bill. We see it in the bills that come from providers. We also see it at the pharmacy. We see it everywhere. Anytime we try to get care, it's a pretty massive bill, no matter which way you cut it. It all comes down to what can you pay for? Because if you can pay more for healthcare, you can get better healthcare and more access to it. At the end of the day, all of these factors that we've talked about, all the different players in the healthcare system are adding to ballooning costs of care. Let's take a look at those numbers. We've got $4.9 trillion in total spend in the United States, according to CMS 2023 data per person cost. Each individual costs $14,570. And as a percentage of GDP, we are getting closer and closer to 20%, a fifth of the entire US GDP being just healthcare. That seems a little unsustainable. I could be wrong, but that seems unsustainable.
It's funny that you mentioned that in the sense because we've been talking about that unsustainability my whole career for the last 25 years. The question is technology enabling us to do more with less? It certainly hasn't bent the cost curve. And I think more so than just cost, I think what we have to increasingly talk about is value, right? Value is quality or higher quality care divided by lower cost. And in order to gain value, you also have to have access to care. And then as an individual patient, you have your own experience. Right? Because experience deals with how you have a relationship and that relationship and the consistency that builds trust with it. So value in healthcare is, I think, increasingly how we have to talk about it. And in a world where cost is going up and value stays the same, or quality stays the same, value goes down.
Well, does quality stay the same? Because if you've got physician shortages, you've got clinician shortages, broad strokes, that includes nurses and the entire coordinated care team, you're looking at sort of opposing factors, right? You're trying to provide quality care in an age where there aren't enough people to provide that quality care, in part because, to your point of physicians being employed, I know of many physicians that are just calling it quits. They're going into corporate environments and not practicing anymore, or practicing very limited just to keep their licenses active. So it seems like we're in a world now where, yes, the goal is to get value. Yes, the goal is to provide quality. But the underlying factors to help promote that don't exist anymore. How do you contend with that?
You've characterized the complexity of it really well. There are people, processes, and technology that I think that there are deficits and gaps. But I want to go back to something far more fundamental than that. And that's, why do people get into healthcare? Right? So why do people choose healthcare? Because you could choose something based on what you're talking about, a lot easier environment to work in.
But wait, are you, okay, yes, but are you talking about the idea that people get into healthcare because they want to help people? Because
it's a calling.
It is a calling, but there are some people who do get into it for the money.
Sure, and I'm not gonna debate human nature with you. I think that's true and that's fair. But my presupposition and my assumption of positive intent is that people go into healthcare because they want to help people. They've had experiences in their life that would say, I have this vocation or this calling that's more important than my own personal beliefs. I want to serve other people, and I think, that has to be thrown against the great obstacles ahead of us. And, again, going back to this concept of the Stoic philosophy that I love so much, the obstacle is the way, right? Your reward for alleviating obstacles in healthcare is more obstacles, right? And if we can have that mindset that we're doing it for the right reasons, for patients, for families, for the communities and the society that we live in, it's not a solution. But again, it helps bolster us and bolster that important relationship. If there's a solution to the challenges of healthcare, it's the relationship between a patient and their physician or provider.
I love your optimistic, altruistic, the world is a happy place attitude, Dr. Moseley. I wish that I could get on board with you, but I do have a little bit of cynicism about, the folks that are in the system. I think it's most obvious, and I'm going to bring up something just really randomly on a tangent to support this idea. Rural healthcare, right? Been ignored for years. All sorts of pleas to help fund it. Mm-hmm. The government has finally announced a historic $50 billion funding. Everybody crawled out of the woodwork to try and get a piece of that pie. You've got big tech companies that are able to sustain their financial books just fine, going after and bidding in bidding wars for a piece of this pie. That's what I mean when I say that, all these other factors, you may be in it for the right reason. You yourself as a physician may be on the right track, but there's so many other factors that are compounding the problem, adding to costs, adding to the burden that patients then have to take on as more and more gets added to the system. AI is now part of that, right? Mm-hmm. Health systems have to invest in AI. That's an investment. That's a cost. And there's no way around it. That money has to come from somewhere. So all the cost factors of healthcare are a little bit outside of all of our hands. And there's no outlying entity that can just clamp down and say, okay, no more. This is it. This is all you have to work with.
Yeah, you bring up a great point with rural healthcare. Many of us believe if rural healthcare fails, it will put a further strain on the healthcare safety net, and the traditional healthcare systems are poorly equipped to take on that additional strain. I think, again, it goes back to, what is the U.S. healthcare system? Is it a true system of care, or is it fragmented pieces and parts that we piece together over time? The history of American healthcare is punctuated equilibrium. We have something like the COVID epidemic that suddenly makes telehealth a reality for so many more people, right? Horrible thing with the COVID epidemic, but a punctuated equilibrium jump forward for us to be able to use telehealth more effectively and to reach more patients. So the question is will technology enable us to make more of those quantum leaps forward? The ability to serve more patients at lower cost, to reach people in rural communities and give them access to world-class care that they might not have otherwise had before with local players. The verdict's out on that, or not out on that, but it's important for us to think through how we can bring value to patients by offering that novel, innovative way of delivering care.
I have goosebumps. I think you should just drop the mic and walk away. I think we're done. Well, we are done. That's all we've got for today. Thank you so much for joining me today, Dr. Moseley. I guess if you've taken anything away from today, it's that as long as you learn how to navigate through this complex healthcare system, you're going to do a much better job, and it'll be much easier for you to navigate your healthcare journey. Don't forget to join us on the next episode of Give It To Me Straight Doc. I've been your host, Anjalee Khemlani. See you next time.